Male sexual act. This is the participation ng male sa copulation. Okay? This one results from inherent reflex mechanisms integrated in the sacral and lumbar spinal cord. So, syempre, pag na-injure mo yung nerves na yan, o paano pa matatransmit yung naramdaman mo here? Papunta pa akit sa brain. Hindi na. No? So, ingat-ingat sa mga nagmamotor dyan. No? Huwag nyong ida-damage ang sacral or yung spinal cord mo per se. It begins with the sensation, with the stimulus. It is transmitted by nerves in the glans penis, then travel through pudendal nerve. Pudendal. Tandaan ha, pudendal. Yan. Then to the sacral plexus of spinal cord, then to undefined areas of brain. But it may also be caused by internal structures such as in bladder, prostate, and psychogenic stimulus. May also be caused by internal structures such as, highlight ha, inulit lang, bladder and prostate. Sexual drive can result from the filling of the prostate or bladder. Kapag puno na sila minsan, it can lead to sexual drives as well. Psychic stimuli can also enhance ability to engage in sexual act. Stages. Pleer, P-L-E-E-R. It begins with erection, assisted by lubrication, then emission, ejaculation, and then resolution. Glans penis is the most important source of sensory nerve signals for initiating the male sexual act. Yung glans. Ito yung drawing natin mukhang mukha, no? Dalawang cavernosa, isang spongiosum. Okay? Sa spongiosum, andun si urethra. Penile erection. This is due to your parasympathetic stimulation. Para, patayo. Okay? Or point and shoot, di ba? Parasympathetic erection, pampatayo yan. Okay? Whereas yung sympa, shoot, pang-eject. Anyway, parasympathetic erection, this is because of the release of nitric oxide. No? Vasodilatory. Pag nag-vasodilate yung mga blood vessel dyan, yan na, mag-erect na. Penis. Okay? Nitric oxide activates guanylyl cyclase. Ito yung enzyme na gumagawa ng cyclic GMP, which relaxes the arteries of the penis. Again, parasympathetic nerve fibers will release your nitric oxide and or VIP, vasoactive intestinal peptides. Si NO, highlight nyo yan, activates guanylyl cyclase that will lead to increased formation of cyclic GMP. Cyclic GMP relaxes the arteries of the penis and the smooth muscle fiber in the erectile tissue of corpora cavernosa and spongiosum in the shaft of the penis. Penile erection then occurs. The sponginess is responsible for erection. Parasympang nag-stimulate ng nitric oxide production. This is vasodilatory, tandaan. Pag nag-vasodilate, ayan o, engorge na, punong-puno ng dugo. Vasodilate, blood will pool in the erectile tissues of the penis. So, engorge with blood, titigas, mag-erect, erection. Take note of the second messenger, cyclic GMP. Sexual stimulation causes, cavernous nerve activation. The nerve will release nitric oxide, activating guanylyl cyclase. Then the cyclic GMP, magre-relax, erect. Relaxed vessel, daming laman na blood. Okay? So, ano naman to? Si Viagra. Anong effect niya? Cyclic GMP, pang-promote ng relaxation. Pero hindi naman siya forever nandyan eh. I-degrade siya ng enzyme na si PDE, phosphodiesterase. O pag na-degrade si cyclic GMP, wala na. Wala nang magre-relax, hindi na siya mag-erect. Ngayon, the job of your Viagra, this one, sildenafil, it will inhibit phosphodiesterase. Cyclic GMP, si Viagra, blinak na yung PDE. Haba na ng buhay mo dyan, long half-life ka na. It will promote relaxation, it will promote erection ng mas matagal. Okay? So, si PDE taga-degrade, wala na si GMP, mata-turn off na, bigyan mo ng PDE inhibitor. Yun si Viagra. Tandaan na, phosphodiesterase inhibitor, ang sildenafil. So, prolonged ang buhay ni cyclic GMP, it will remain within the system, sustained na ang erection. Lubrication, also parasympathetic. Lubricating substances will come from your bulbourethral glands. Okay, constant friction will also lead to more erection, then lubrication, then emission and ejaculation. Emission and ejaculation is due to sympa. Tandaan na, sympa ang ejaculation. Point and shoot nga eh. Point and shoot. Pampatayo, parasympathetic. Pang-shoot, pang-ejaculate. Sympathetic na yun, ha? Sympathetic nervous system. T11 to L2. Okay? Thoracolumbar siya. Hypogastric and pelvic sympathetic nervous plexus are also involved. Kaya nga yung mga patients minsan na aksidente, yung spinal cord damage, pag ang area is from sacral, thoracolumbar, di wala na. Hindi na rin yan mag-ejaculate, etc. Hindi na makaramdam, di pa maka-ejac. Emission is due to contraction of your vas deferens and ampulla to cause expulsion of sperm into urethra. Ejaculation, wave-like, highlight wave-like and rhythmical contraction of urethra to expel semen to the external environment. Then resolution. Okay, this is a final process, cessation of erection. Know the sequence. Again, cavernosum, spongiosum. Sila nafe-fill ng blood kapag naka-para mode ka. So, pampatayo, parasympathetic. Pang-erection. Okay? This is the arrangement of the vasculature and cavernous tissue within the penis. During the flaccid state, lanta si Manoy, blood flow into the cavernous spaces is limited by contraction of the helicine arteries. Okay? Nice to know lang yun. Ayan si helicine arteries. Okay. Take note of the neurovascular events leading to penile erection. Must know ano ang second messenger, anong pinopromote niya, who will degrade that second messenger, who will synthesize that second messenger. Okay? Masculinizing hormones, mga andro. Okay? Sila testosterone, androstenedione, DHT. DHT is the most potent. Paki-highlight to ha, si DHT. Yan. Para mukha kang externally male, yan, DHT may kasalanan dyan. For development of external male genitalia. All of these are steroidal, may CPP ring, cyclopentano per phenanthrene, per hydrophenanthrene ring, maalala niya yung cholesterol nucleus. Okay. Effects of testosterone, development of male external genitalia, para bumaba ang testis mo, from abdomen, pababa. Development of sexual characteristics, yung bigote mo, etc. Hair growth, male pattern ng baldness, hypertrophy of larynx, kaya mas malaki yung larynx ng males, mas malalim ang boses. Ayan, tigyawat. Joke lang. Some effects lang yan ng testosterone. DHT is more potent androgen formed from testosterone via 5-alpha reductase. Okay? Ayan, testosterone magiging DHT using this enzyme, ha? Si 5-alpha reductase. Minsan, binablock natin yan. We give 5-alpha reductase inhibitor sa pharma to decrease your DHT. Okay? Para hindi na lumaki yung prostate. Especially for patients with BPH, benign prostatic hyperplasia. Must know some effects on testosterone. It will increase yung kapal ng mukha mo. Hindi, joke lang. Thickness of the skin and development of acne. Protein formation, muscle development. Mamuscle ka nga, matigyawat ka naman. Bone matrix and calcium retention. BMR, RBC. May effect rin siya sa electrolyte and water balance. Males are more muscular due to testosterone. Mas marami silang testosterone. Anabolic ang testosterone. Pang build. Okay? Anabolic sa bone and muscle ang testosterone. Males have higher hematocrit count kasi nga merong erythropoietic influence ang testosterone. Yan. Testosterone levels nagpipik dito sa adult age and medyo nagde-decline sa old age. Okay. Alamin nyo lang sa nagpipik. How do we regulate? Basta-basta na lang ba mag-secrete ng testosterone to? Siyempre may yan, hypothalamo, pituitary, gonadal axis na naman. O ito si Lolo, hypothalamus will secrete your gonadotropin-releasing hormone, RH. Okay? It will activate the anterior pituitary to release LH and FSH. Text niya si anterior pituitary. Ito si Lolo, oy, son. Gagawa siya. Labas ka na dyan from anterior pituitary, no? Dalawang sons na dyan, dalawang magiging father, si LH and FSH. These are your gonadotropin. Ito, gonadotropin-releasing hormone. Pumunta siya doon, oy, i-release mo ang gonadotropins. Si LH and FSH. Yan, dalawang ama. Si Lolo, grandfather, this is the father. Pupunta siya sa mga to, doon sa testicle, sa gonad. LH, babatukan si Leydig cell. Leydig cell, labas mo na yung second generation dyan, yung mga Junakis, yung mga son. Pag Leydig, testosterone. Pag Sertoli, si FSH naman mag-stimulate ng Sertoli cell. Sisigit siya ng inhibin B. Okay, pang inhibit kay daddy. Yan. Inhibit kay FSH. Among other functions, ha? Marami pang effects si Sertoli cells, diba? Spermatogenesis, etc. Leydig cells will secrete your testosterone. Pag okay na si testosterone, marami na masyado, sabihin niya, oh, dad, shut up. Lolo, shut up din. Oh, feedback inhibition yan, okay? Hypothalamus pituitary testicular axis. Your testes will produce your testosterone, specifically si Leydig cell for your libido. Kung ayaw mo nun, Lorna Tolentino. Leydig testosterone. Inhibin B dimer yan, produced exclusively by the testes, predominantly by the Sertoli cells in the prepubertal testes, no? Bago ka magbinata. While the site of production in the adult is still controversial. Inhibin B controls FSH secretion via a negative feedback mechanism. Pinapa-shut up ni inhibin B itong daddy niya, okay, si FSH. Whereas si testosterone, pag marami ng testosterone, tapos na yung job niya, papashut upin niya. Dad, dami na namin dito. LH, shut up. Lolo, ganun din. Negative feedback. Ito si inhibin B, hindi niya kayang pa-shut upin yung lolo niya, ha? Ito lang si daddy FSH niya. LT, Leydig, testosterone. The Leydig cell will influence spermatogenesis because the Sertoli cells will capture the testosterone to support spermatogenesis using ABP, androgen binding protein. Sertoli produces ABP, androgen binding protein, to capture testosterone and then promote spermatogenesis. Kakasabi lang. The testosterone sa testicle will also influence the blood or circulating testosterone. Very low level in testosterone sa blood compared sa testis. Tandaan. Yung mga testosterone sa blood pumupunta sa body parts for its metabolic effects. It will also perform negative feedback to your brain. Papashut upin niya yun si interpretary at si lolo. Paano pag nag-exogenous source ng androgen ka? Kunyari nag-inject ka, nagturok ka ng steroid, no? Androgenic steroid, ayan. Kasi gusto mong lumaki muscle mo, eh. Alam mo yung effects ni testosterone, eh. Anabolic, no? Pang build. Ano mangyayari? Oh, hindi naman alam ni daddy yan na hindi na pala, na synthetic form ng anak yan, yung nakita niya sa blood. O, di ba mag-negative feedback yan? Parang pineke yung negative feedback. Okay? O, ano mangyayari? Marami ng testosterone, inject ka ng inject eh. O, pag nakita yan, mag-negative feedback yan eh. O, sasabihin, uy, ang dami nyo na pala dyan. Testosterone. Uy, sasabihin nila, o nga, marami na sila. O, di, shut up na tayo. O, shut up. Ano mangyayari kapag wala ng LH and FSH? O, wala na mag-stimulate sa testicle mo, liliit ang bayag. Okay? Yan. Tandaan, ha? So, hinay-hinay sa pag-inject. Laki nga ng muscle mo, liit naman ng balls. Ay, mga bodybuilders or athletes, they try to increase their muscle or performance by injecting yung mga androgenic synthetic hormones, yung mga testosterone. Nag-negative feedback yan kay lolo and kay dad. Okay? So, onti ang gonadotropin-releasing hormone mo, onti rin ang LH, onti ang stimulation sa Leydig cell, decrease ang production ng testicular testosterone, yari ang sperm production mo. Late na ng egg mo, baog pa, no? Compromise ng sperm production. Exogenous androgen, magne-negative feedback sa brain, tandaan. The blue picture here depicts that the testis at the right has undergone atrophy and is much smaller than the normal testis at the left. So use of anabolic steroids diminishes testosterone levels produced by the body and leads to testicular atrophy that diminishes sexual function. Okay? This is your gonadotropin-releasing hormone. Wala lang. Regulation, ito si inhibin, yung isang son na pinapa-shut up niya, si FSH, primarily si FSH. Okay? HCG, ganun din, responsible for development of the testes during fetal naman, ha? Fetal era. Okay. Ano yung sinabi natin? Again, inhibin B, si daddy niya lang pinapa-shut up niya, primarily. Okay? Yan. Tawag dito hypothalamic, pituitary, gonadal, or ano bang gonad sa lalaki? Testis, so testicular axis. This is the postulated signaling pathways between the hypothalamus, anterior pituitary, and testis. Solid arrows indicate excitatory effects, whereas dashed arrows indicates inhibitory effects. Yan. Testosterone, pinapa-shut up niya rin si lolo niya, ha? Siguro daw ito releasing hormone. Tandaan. Okay. The difference in intratesticular testosterone versus circulating testosterone concentrations and its importance in the hypothalamic pituitary gonadal axis. Yun, in-explain ko na ito kapag nag-inject ka ng testosterone, syempre pick up yan, mararamdaman niya ni lolo at ni dad, ni hypothalamus at ni anterior pituitary. Ang dami ng testosterone. O sige, huwag na tayo magtrabaho. O, dahil doon, wala nang nag-stimulate sa testicle. Yari ang sperm production and yung development, yung pag-grow ng testis. Hintin ko lang, ha? So, administration of testosterone for an androgenic analog increases circulating testosterone, which in turn increase negative feedback on release of LH. Bababa si LH, diminished ang Leydig cell activity. Si Leydig hindi nagagawa ng testosterone. Wala si LH eh. Hindi niya dinidiktahan. Si Leydig na mag-produce ng testosterone. So, lowered ang intratesticular testosterone mo, magkakaroon ka ng reduced sperm production and can cause infertility. Okay? Wala lang dyan inhibin feedback. May climacteric hypothetical period in some men na parang na-compare siya into female menopause. This is also known as male menopause. It usually occurs 10 years later than in women and appears to be associated with declines in the levels of testosterone among other hormones. So, merong decrease in male sexual function, hot flushes, suffocation, and psychic disorder in some males. Erectile dysfunction, also known as impotence. Dito, unable to develop or maintain an erection of sufficient rigidity for satisfactory sexual intercourse. Hindi na tinitigasan. Okay, ganun ang mga reklamo. Sabi ni tatay, hindi na po ako tinitigasan, Dok eh. Ano kayang sakit ng meron? O kaya anong pwedeng solution dun? You have to investigate first anong causes ng erectile dysfunction niya. So, alamin mo sa past medical history. Na-aksidente po ba kayo dati o naoperahan? Yun. Or may tinitake po ba kayong gamot? That's why it's very important na dapat complete ang history and PE mo. Okay? Yung pala, na-aksidente sa motor, na ano yung plexus, sacral plexus, etc. Or nag-anabolic steroid siya, napeke ang negative feedback. Yan. Know the definition of erectile dysfunction. And ano yung mga causes? Trauma to the parasympathetic nerves. Bakit para? Kasi siya yung patayo, di ba? Point and shoot. Ito yung pampatayo. Problema nito, hindi natigasan, no? Ng parasympathetic or patayo. What else? Kailan magkakatrauma? Lagi bang sa motor na lang, Doc? Hindi. Pwede rin sa surgery, no? Deficient levels of testosterone and some drugs can also cause impotence. Okay, particularly when they age. That's it. Thank you. Study smart. Keep safe.